Hello everyone. Thank you so much for joining this session. We will wait for 2 more minutes. In the meantime, I will give quick introduction of Smriti. So I guess we all have been there rushing through meals, skipping breakfast, grabbing whatever easiest between back-to-back meetings. But did you know that your gut health directly impacts your energy, focus, and overall well-being? Digestive issues like bloating, acidity, constipation, and IBS are not just minor inconvenience. They are sign that your gut is struggling. And when your gut struggles, so does your productivity, immunity, and even your mood. To mark World Health Day, we have organized this special free webinar today featuring Ms. Smriti Mishra, a leading clinical nutritionist with 17 plus years of experience in gut health, nutrition, and wellness. Over to you, Smriti. Now you can start with your presentation. Thank you.
Thank you so much. Thank you so much. I would really like to thank Team INT Care and our wonderful host for organizing this apt topic. And this could be the best thing that you can organize and give a message on this World Health Day. So let's begin the topic. So today's topic is gut health at work, managing digestive issues in a busy schedule. So I'm sure every day you have something in your mind that okay, today I have to be very productive. Today I have to. I mean you have a checklist of work that you have in your mind, but in the hustle of life, in the hustle of this work-life balance, you forget to take care of your gut. So through this presentation, I would like to give you a message, some tips, some practical strategies, how you can manage your gut effectively and efficiently. So these are the key points that I will be covering. I'll go in very basics about what is gut health, and I'll give some historical background also. Uh, I would especially like to mention a recent research that was a research uh, happened in 2023, and this came from Harvard Health, that says that a healthy gut, that means you have a better energy, focus, your immune system is strong, and that is why you could be more productive at your work. So 70% of our immune system is in our gut. That is why the world today is considering gut as a second brain. Next, we will cover the common digestive issues. I'm sure majority of the employees have such issues like bloating, acidity, IBS, constipation, etc. So I'll be covering all these things, how you can manage it efficiently. There's one more research, and that was done on corporate employees. That is very helpful for you all. You can take insights from here. You can go and check the website NIH. This is a very helpful study which says that 60% of corporate employees report such kind of complaints, that they have this discomforts. But I would strongly suggest to not normalize these stomach discomforts, because this is going to hamper your productivity. Lastly, okay, further we'll talk about some science-backed solution, some practical strategies, some practical tips that you can follow on day-to-day life, and role of hydration, sleep, and stress control. We also talk about some myths and facts. So going in some historical background, see, this is a in very ancient time, almost around 5,000 years ago, Ayurveda had depicted the role of gut health in immunity and our work life balance. That time the structure of work and the type of work that we were doing is completely different than what we are in, but they have already mentioned it, that gut is something that you need to very cautious about it. Then came in 400 BC Hippocrates, that said that all diseases begins in your gut only. See, the majority of things is related to your immunity, your intestine linings, and so they talked about the gut. That time they had highlighted enough how that digestion, that abdominal discomfort, diseases, this all related to your immunity and that related to your work. Later in 19th century, scientists discovered that the gut microbiome is directly linked to your, digestion, the process, and of course the immunity. Later in 20th century, when, thanks to this pharma industry, when they came up with antibiotics, but unfortunately, the food industry came with some processed food, packaged food, canned foods, and we, the working person, trapped into their, web. The modern research, that is of 21st century research, this again confirm that the gut brain axis, this is what had actually the role in your work focus, your productivity, your overall routine, and the way you are involved in day-to-day basis. When I say the overall you are involved means how happy, how focused you feel at your work, and at the same time when you return back to the home from your work. So this is entirely depending on your gut brain axis. So we'll talk in detail further. And hence come the role of probiotics and prebiotics. You must have heard a lot about probiotics thanks to the social media also. Every day we, see lots of advertisement about probiotics. This product is good, that product is good. Many of the product, they claim that they are the best probiotics, etc. So thanks to social media for the campaigning. Before we further go deep into this topic, let's salute first who was actually, that time the influencer, you can say that time influencer, when there was no social media, when there was no hype at the social media. So he was Dr. Eli Mechnikov. He was a Russian immunologist. He was a Nobel Prize winner in 1906, and he researched on Bulgarian villages. Bulgaria is in Southeast Europe. So there he studied that when they use more of the fermented foods in, almost daily, they used to eat a lot of fermented foods. So that was linked to their gut health longevity, and they aged late. So this was very important study, and then the world take that study far, and now we have many more advanced studies, and we actually started considering why gut is the second brain. So we start with saluting Dr. Eli Mechnikov, who was the actual and who is the real influencer of probiotics. Okay, so the present corporate gut crisis, and why it matters. Many of the employees, I mean, and the one of the study confirms that 60% of corporate employees suffer from, one or other kind of stomach discomforts like bloating, acidity, constipation. And this was the study that this was a very recent study done by Harvard Business Review, that is published over there, which says that 60% of corporate employees suffer from this kind of stomach discomforts. And the last year when NIH, that I had told the study in my previous slide, that this directly impacts your work focus and productivity. And of course, the office lifestyle is such that you spend a lot of time, even you continue to sit at one position, and you don't get time to, get up, move around, and sometimes you're forced to eat only processed and packaged food. So this is the further, deteriorating your gut lining. Okay, someone has raised question. I would request you to put up the question at the end of the session, so that, I'll take all the questions. If I won't be able to take questions, you can email me anytime. You can WhatsApp me. I will, answer all your questions. Okay. Thank you so much for your patience. Okay, so I'll start with your gut bacteria. We have 100 trillion bacteria with those are working tirelessly, working 24/7, you know. And this diverse microbiome is actually linked to our uh, work productivity, you can say. The more diverse microbiome, the more focus you will be at your work. Now, most of the factors that these are the very common factors that mess up with your gut line, or you can say that gives you some discomfort, mostly your stomach discomfort. These are the most common factors. uh, the primemost is the late night work stress, because sometimes you log off at your workstation, but you come home and again you have to wrap it up, and so again you log in and then you start doing work. Sometimes you don't have time to eat properly cooked food, home cooked food, and you end up eating some packaged food or some picky foods, and that is not at all healthy for your gut. Second most important factor is the caffeine intake, the coffee intake. Tea coffee lovers actually sometimes they are seen to replace their meal with a cup of coffee, replace with a meal with some very handy or picky things. And also alcohol consumption sometimes, mostly your Friday nights party in the at office, you end up having lots of, you almost soaked in alcohol, and your gut is again just saying that, okay, now you have given me such things, you have inviting me to deteriorate your gut lining, so I'll just give you the result. um, the next factors are the process of snacks. As I had told you that you mostly don't get time and you end up eating packaged food, canned food, without understanding and is saying at the back of your food packets what is the nutrient actually it is mentioned what you are consuming. And one more factor that I would like to add is sometimes you copy. If your friend is eating, if your coworker is eating particular food, and you see that, okay, he or she is getting good result, okay, I'll also do that. But do not copy that. I would strongly suggest your gut, the way your gut will behave will entirely different from what your coworker's gut. So do not just copy their food style. It should be very unique, because your digestion, your process is very unique. Every body has a different metabolism. The very important factor is stress. We have mountains of research on stress, and it is natural. I'm not saying that you will read the presentation and will stop taking stress. Stress is natural, but you have to come up with some solution, because when the study came, this is a very recent study. Why I'm putting all the recent studies, so that I just want to make you aware that these are the study, and now you have to be very prepared and ready. You are only the person that can take care, that can take very good care of your health, your gut. No one will come and just help you. Okay, so start something, start any one good habit to reduce your stress. So starting with this study, stress disrupts gut bacteria and slows digestion efficiency. See, sometimes you must have observed that, um, let's say your coworker, one of your coworker, he or she eats good, he eats enough, but his digestion is also good. He is able to digest many things, and there's no very prominently you can see any discomfort. But if you, even a single meal if you eat from outside, or you eat anything, any packaged food, you start complaining of your discomforts. Why? Because the way his gut lining is behaving may be very different than you, or his lifestyle would be different from you. He or she must be having one such stress buster, um, you know something that he or she must be involved in that you are not into. Maybe sometimes they open up and share, sometimes they not. So if you will just let the stress persist, that chronic stress will lead to irritable bowel syndrome, that further may leads to diarrhea or constipation, some acidity that we call in scientific language as acid reflux, and bloating. This is the most common complaint at workplace. So what can be the quick fix? The quick fix can be deep breathing before you know um, any serious work you are indulging in, or you have any long meeting, so that you can do first thing. And second is, please avoid the last minute junk food. What we mostly do is, okay, we have a meeting, boss has called an urgent meeting, okay, let's engulf whatever is available here. Okay, just eat any fried items, any packaged food, anything handy which is prepared. Just avoid that. That is for long term. That's not at all good for your gut. Always think about what is going to give you at the end result. You always talk about, and you always speak about this at your office, right? What is the end result? So you should always keep in mind about the end result of any food, how that food is going to impact your gut health. Okay, so after the stress factor, one more is the fiber deficiency. This is the most common deficiency in present era, you can say. And one more studies again, the 80% of employees don't get enough fiber. This is the last year study. And when I say fiber, that means it can come from either in salad form, raw or cooked form. Raw form is salad, cooked form is light sauteed veggies, or some fibers are in the form of, like, I can say oats that you cooked, that you take in your breakfast meal. Or there are many food options that comes under soluble fiber and insoluble fiber. So what kind of fiber is required for your body, for your gut health, is that depends when your assessment is done. So fiber, when I say fiber is required, so one thing you have to keep in mind is more of the fruits, salads, vegetables, these three, and whole grains. Whole grains often comes with a good amount of fiber. But some person has a leaky gut. Some person has not that kind of digestion uh, digestion level that you can easily digest anything. So that time you need to very selective about the type of fiber you are taking. That I told you about, the type of fiber is soluble fiber and insoluble fiber. So what kind of fiber your body needs? For this, you have to speak to your concerned dietitian or your doctor before starting any fiber. Okay, because sometimes you just start taking any fiber because as you're copying someone, and that is in spite of giving some benefits, you will end up with again some complaints. So before adding any kind of fiber in your diet, you should once consult with your concerned dietitian or doctor, or any certified nutrition professional. Then the next culprit is coffee. We often skip meals, replace meals with a cup of coffee. And the coffee is the one thing that gives you more acidity. If I say one cup of coffee, that is means the standard 250 ml to 300 ml of coffee cup. That is more of the, and if increase the number of cups, 2 cups, 3 cups, then amount of caffeine also increases, and that increased amount of caffeine is going to irritate your gut lining if there is no food and only caffeine you are taking. So the most common symptoms or the common complaint that people come with is acid reflux or acidity, commonly you say. Okay, so some tips for if you have no choice but having a cup of coffee, you can pair it with some healthy nuts like almonds, walnuts, okay, very few pista, because those are the healthy choices, and it's very mindful eating also. And hydrate well before having tea or coffee. It's good to have a half glass of water, to maintain the um, uh, if I say to have water before to maintain the alkalinity of your blood. So it's good to hydrate before taking coffee, especially coffee or tea. And you can also add one herbal tea or green tea or any there are many herbal teas available in the market. There are some researches done on pea flower, that is a blue flower, that rosemary tea. There are so many herbal teas available in the market, and those are good. Those are healthy choices. You can swap it with your regular coffee. You can just try. You will not have any complaint then acidity or something, because it is going to give you only advantage, not a single disadvantage. It will give disadvantage only and only if you have intolerance or you're allergic to some food items. Okay, so next we'll talk about acid reflux. Acid reflux, this is the complaint that you mostly come up with uh, when you have gone with a dine out, or when you have heavy lunch from outside. Of course, home cooked food barely gives you any acidity, because you know what you are cooking, you know what your body demands, you know what is your choice, you know what food you can digest well. So home cooked food very rarely give you acid reflux, but whenever you eat outside, there are the high chances that it will give you back. And I have few clients or patients, they often keep pan 40 with them, and they often take that before meal or after meal and say, okay, now everything is sorted and everything is fine because I have one solution. But do not make this as a practice, as a habit. Go natural. Tell your gut and feed your gut that no, I will eat good, and you just behave in that way, that you will able to digest it properly and make it right. So you have to channelize your brain, and that's how your gut brain axis work. Uh, this network should be right, and we are only to make it the correct things. Okay, so there was a case study done for this acid reflux. There was a case study done where it was shown that 1 in 4 employees had experienced acid reflux after having their spicy office meals. When I say office meals, is the food which is prepared in office cafeteria. So this is a very recent study that was done, and I'm sure you must have come across many of your coworkers who has complaints like this. So what are the easy fixes for this? You can the best thing is go slow and go for small portion. Okay, do not frequently eat in your office, but if you don't have time, sometimes it's okay, but go for a smaller meals. uh, don't go for full meals, go for combo meals or small meals. And yes, after eating, avoid sitting for long. You know that your lunch is over, you know that you had a meal from outside. Just give yourself a minute, give yourself 2 minutes. That is a 2 minute rule. I'll show you in my next slides how this 2 minutes rule will help you in avoiding all gut related diseases. And do add some digestives at the end of your meal. Like most commonly people use serve. Now you will say, in office, how I will get serve? So store it, make it a small container, store it at your desk, store it in your bag, and have it. There is a solution to every problem. And this is the best. These are the good healthy habits you do, and encourage your coworkers also do the same, because this is gonna help you. Okay. So other than this, uh, I have listed here some best pre-meeting, or what you should eat or what you should avoid before a long meeting. When I say meeting foods, you can consider it as for some work, for any kind of work. If you are sitting, if you know that you have to sit for a long, you can go with this list. This list is very important. Once you start following it, it will give you the result, and then you will consider, okay, and then you will when you will start practicing it, then only you will get the result. And then you will consider, oh, what all things we were doing it wrong. And this is something that majority of the employees do. So I'll just quickly tell you about what are the best pre-meeting foods. You can have banana or almonds, which are the magnesium-rich foods. If you are diabetic or overweight, you can swap banana with apple. Okay, and almonds, they are very good nuts. People with any kind of disease or people who are on weight management diet, they can easily take it because we need magnesium, and magnesium, all the nuts are rich in magnesium. It has shown the result that it helps in reducing your stress level. So it's good to have. It's wise to have nuts before your long meetings. Then you can go for some yogurt. If yogurt is not available, you can have your homemade buttermilk or curd, and add some berries. Berries are again they are very rich in antioxidants, which are found to be helpful in balancing your gut. Then oatmeals and seeds. If oatmeal you cannot take it in office, you can have some seeds, mix of the seeds. You can keep it in your office desk or in your bag. And dark chocolates are something that you can eat without any guilt. Dark chocolates is also rich in magnesium, and but go for the dark chocolates one which is which has more than 70% cocoa. Okay, so always see the nutrient information at the backside of the chocolate paper. If it is 70% plus, if the cocoa level is more than 70%, it's a good choice to have dark chocolates. It's rich in magnesium. It boosts your mood. It activates your brain function, and you will feel more focused. You will see the change. This There are so many research which has been done on dark chocolates. So I mostly encourage my employees, if you are, even if you are diabetic, you can have one small cube, and you can go with higher side of cocoa. You can opt for 80 to 90% cocoa. That even if you are diabetic or weight management, you can opt for dark chocolates. Then herbal tea, that I mentioned in my previous slides, that the role of herbal tea is also very much talked about, and it helps in reducing your anxiety level. And when you feel your anxiety or stress lowers, then of course you will feel more focused and productive at work. And a few things that you should avoid, actually I'll say. First is caffeinated drink in any form, whatever the good names they come up with, but this is caffeinated. So and it will just trigger the acid reflux, and you will again start complaining of acidity. So just try to avoid caffeinated drinks, especially on empty stomach. Fried and greasy things that you all know that you have to avoid, you should avoid. And sugary snacks. If you're going for any packaged food, always look at the back side, what is the nutrient information is given. See what is the percentage of sugar in one serving size that you are taking in. That is very, very important. Even if you are taking a small amount, a small quantity, but what is the level of sugar in a very small pack of any food items of small pack. You could have ingested a lot of sugar, so just look at that. um, One of the most prominent problem at the present day's office, the present workstation, is they are sitting for prolonged hours, and they think that this is the only option I don't have any option. This is only I who have to do the work. I have to finish the work. See, your boss is assigning the work. He or she is giving you the work, no matter how you have to complete. Then why not come up with some solution? Because you have to think about yourself first, and go with the health first rule. You have to take care of your body. Nobody else will come to take care of your health. So I'll strongly suggest start following this 2 minute move after every meal. Just walk for 2 minutes. No matter how small your workstation is, no matter how small your work area is, try to move for 2 minutes. And I'd like to add one study that says that after every hour, if you walk for 2 minutes, you are 20% more increasing the chances of your digestion level. And what is the result? The result is you will be more focused, you will be more productive. That what your boss wants from you, right? More productive. And one few solution that I want to share with you all. You can go with some light twist stretches, some exercise, whatever your workstation is, the small or big. You have, if you have some area, you can twist, stretch your body, at least hand and shoulder. That is very, very important, because this when this alignment is right, that will directly impact your gut lining. Have you seen the picture of your gut, how it is? It is a folded like structure. But when you do when you do some stretching, some exercise, sitting at the sitting position only, it will start activating. And then again, what it is giving a signal to your brain that your brain will say, okay, gut, it is your turn now, it is your time now, now start functioning well. Okay, so this is what this kind of stretch exercises help you with. Another one is the toe touch stretch. It is very very easy. When wherever you are sitting, you have to touch your toe. In the sitting position, you have to touch your toe from right side, from left side. And see, maybe at workstation, your coworker will laugh at you. Oh my God, what are you doing at workstation? But fine, good things can be laughed at. It's okay. It will give you only the good result. And it if your coworker will copy you, seeing you the good result, that's the best thing, that you are helping him or her in another way. So this kind of light stretches exercises you can do. And deep belly breathing is my most favorite. Whoever have attended my session before, or some of my audience who is very frequently attending my session, they know that what is this deep belly breathing. After eating, what you have to do is just put your this all the 10 fingers on your belly, close your eyes and inhale 5 times, 10 times, give a break, and then repeat it. So this is one of the most very result given strategy that you can follow wherever you are. Even if you are eating at your work, you can start doing this. This will give you the very good result, and you will feel very good. The feeling of good is, that feeling is what actually uh, activates your gut. Again, you have to give a message. Okay, you have to think first, I'm giving a good message. You have to, then your brain will activate, and brain will give a message to your gut. Yes, start doing, start activating. Okay. And yes, it's very useful thing if you are having warm water or lukewarm water after your meals, especially heavy meals. And if I say heavy meals, that is the 2 meals which are heavier in entire day, the lunch or dinner or breakfast or lunch. Any 2 meals in your day, in your day-to-day schedules, 2 meals should be heavy, and then other two should be very light. Okay, so after those heavy meals, you can have some lukewarm water, at least a cup of lukewarm water. It will help to soothing down your digestion process. And then chew a fiber is snack that I had previously told you in my slides, the good seeds, good super seeds, or some nuts, the healthy nuts you can include it with. And yes, above all, if at all you feel like constipated at home, but at office you feel like no, that the call is coming, and I cannot just bound myself, then just follow with the natural call. Go when you feel good. There should not be any embarrassment, because this is eventually that will impact your health only. So you should go with this. Go whenever you feel cool. Okay. Now I have enlisted some probiotic and prebiotic sources. Now the world is talking about probiotics, and I'm sure many of you have heard about probiotics, prebiotics. So what are they, and what they are going to do inside your body, how these are helpful to us? So we will know about that. So probiotics and prebiotics, basically these are the two soldiers of your gut lining, and one which is which you take from outside, that is called probiotics, that you take as a supplement and enhance your healthy bacteria. And and whatever good bacteria is inside is within you, you are influencing it, you are giving, you are feeding those good bacteria. So when you are feeding those good bacteria, that is called prebiotic foods. Okay, so I'll repeat it again. Your gut has some good bacteria inside within you, and to feed them, everyone needs fuel, and so our bacteria are the good bacteria which is residing inside our microbiome. So when you are giving good and required food to those bacteria, that is called prebiotic food. Okay, and some of the healthy good bacteria that you take it from outside as a supplement, those are called as probiotics. So together, both the soldiers together make a gut lining better. And again, I want to share one study that is again a very recent study, and it shows that employees who consume probiotic can experience 25% fewer sick days. Fewer sick days means your HR has a good news. That you will take fewer sick leaves means you will work more, you will be more productive, and overall you are going to give good result, because when you are more focused at work, you can give good result at your work. So your boss your HR team especially will be very happy. So to reduce your sick leaves, you start eating probiotics, or start feeding your good bacteria inside your gut as a form of prebiotics. So um, I'll quickly share what are the sources, what are the good sources of probiotics and prebiotics. Probiotics are basically fermented foods like yogurt, the most important, yogurt and buttermilk, curd, buttermilk, you know that. These are kimchi, kefir, miso, sauerkraut, tempeh. Tempeh is a soya protein, okay? And these fermented foods are called probiotics. You can easily take it from market also, but I would strongly suggest you go with your desi fermented foods like buttermilk, curd, or sauerkraut. You can easily make at home. Go with the choices that you can easily prepare and make it at home, because whatever your body is very accustomed to your cooked meals. Okay, I have just only put small variation and the thing is okay. And prebiotics, as I told you, that prebiotics are what you are actually giving a fuels to the bacteria which are already present in your gut. Okay, so these foods, the examples of these prebiotics are banana, onions, garlic, oats, barley. And very important thing here is I have mentioned chicory root. This is also a very talk about topic, chicory, role of chicory root. Lots of research has been done, and the powder form of chicory roots are available in the market, online platform or pharmacy. You can take it as a supplement powder. These roots are basically you can found being originated in the North India, but its supplements are available from any parts of India. You can have it. So and these results are good. So I'll suggest you, if you can start including chicory root for some time, just feed your bacteria inside your intestine, and then you can switch to some other food options. So this root is really giving a good it is actually helping your gut lining, and it's the results are very visible when people come with solution that okay, I got my solution for my disrupted gut lining. So chicory roots are really good, I strongly suggest. Now some of the natural prebiotic, if you're not going for this supplement chicory roots, then other these food, these are very well researched, and uh, these are giving the very good results when you take on day-to-day basis. or even you can take twice or thrice in a week. Means you have to very you have to plan your food menu. If you are struggling with any kind of stomach discomfort, you plan your menu and include these food items. So these natural prebiotics, these are the examples of natural prebiotics. These are the most common are banana, garlic, onion. The unique part is the role of leeks. Asparagus. Asparagus is a, again, a green, is a dark green like vegetables you can see. And asparagus is, if you are not able to find it asparagus, you can switch it with other options, like you can go for leeks. Leeks are, again, I have here I have mentioned that I have yes, the images here you can see these are onion leaf like vegetables. You can, if you are not able to find it very easily, then you can switch with other option. But like the places where I am in, or when my clients come to me, they say that sometimes it's very difficult to find leeks or asparagus. Then I say to switch with the other natural sources that you can easily find it with. It's not important that you only go and get some unique item that nobody knows, and wow. No, it's fine. There are 10 sources. If you're getting other 4 sources, fine. But feed your good bacteria. So these are the options. Apples you will easily get, oats, barley, onion, garlic. These are the food sources that you will easily get, and I'm sure you must all be using that. But mindfully use that when you are struggling with gut lining disorders, diseases, or discomfort. uh, you plan your food menu of the day like this, that you have to include these items. Okay. Now here I have mentioned short chain fatty acids. So I would like to explain this, why short chain fatty acids are good for you, how this is helping in your maintaining gut lining. And I'll start with the sources. So what are the sources of short chain fatty acids? So these are, again, oats. Oats is rich in soluble fibers, short chain fatty acids. It gives you fullness. So it's a very it's a complete package that you can go with. But whenever you go to have oats as a meal, or whatever recipe you're going to plan, go for steel cut oats. Steel cut oats is very different than what the regular oats are. Regular oats are very processed one. So I would suggest steel cut oats, but steel cut oats takes time. So you should be very patient, or go with the menu when you have time. Okay, so don't blame me for what she has suggested. Steel cut oats is taking lots of time, but you just prepare on that day when you have time, because that steel cut oats will give you benefit. It is if you're going for healthy option, that is the steel cut oats, not that processed, the regular one oats. That barely gives you any advantage. Okay, so go with steel cut oats. The other options are lentils, whole pulses, or green bananas. Okay, and boiled cold potato. When you boil, put it in the fridge, and after that you use it. It develops resistant starch, so that is helpful. So these are the examples, and it helps in, see, the work is the same. What they will do is reduce the inflammation, reduce the the all the things which are stick in your gut. They will help flushing out that, and then you will get relief of constipation or acidity. So in short, uh, whenever you feel like, you can include short chain fatty acid foods with the sources that I had mentioned. You can include mindfully. Yes, I'm gonna have to include this, and you can just distribute in your breakfast, lunch, dinner, however you want to. Chicory root, I had mentioned you this. These are available in the market in the form of powder. Uh, there are other forms also, but powder is the most very. It's very convenient to use, and it's like a coffee. You are replacing a cup of coffee with chicory root powder, so you can easily use that. There are again some research done there are lots of research. So basically, it helps in reducing your inflammation and clearing the gut lining. Okay, so you start using it, you will feel the difference, because there are a lot of research done, and when the research is done, that means the already study has been done. So go with it. Then again, I had earlier spoke about hydration, how hydration and sleep is important. Uh, if you're not hydrated enough and end up having more of the caffeine rich food or a caffeine rich drink like tea or coffee, mostly coffee at office, so it will what it will impact is how it is deteriorating your gut lining. It is obstructing your digestion process, the whole metabolism, and you will again end up with all the discomfort, stomach related discomfort, mostly constipation or IBS. IBS is irritable bowel syndrome. So hydrate well, and how much glass of water you should drink is, we roughly say 8 to 10 glasses of water, but that depends on your weight also. So go with 25 to 30 ml per kg of your body weight. So that is the ideal water intake it should be. And since the onset of summer is already there, so you should start hydrating well. And I suggest make it more infused, more of have more infused water, infuse it with mint or any of the fruit like cucumber. You can infuse it with mint, some nutritious item you should include it in, and have infused water. You can also add some seeds inside. That super seeds will work tremendously good. So this is the way you can hydrate well your body. And again, sleep, there are a lot of research again on sleep, how this is disrupting your gut lining and all. And it raises cortisol. Whenever your sleep is disturbed, your cortisol level is up. It will it will just impact your digestion, the process, the whole metabolism. So the two things you should always take care of, your sleep and hydration level, especially in summer season. Okay, so again, what are the quick fixes? So quick fixes, again, these are the same: no heavy meals. Okay, especially when you're going to sleep. So before 2 hours, 2.5 hours, we say before sunset you should have your dinner. But for working professional, it is just next to impossible sometimes. So you can do one thing, that at evening you can eat something very heavy. Okay, but something means eating healthy things heavy, and then night have very light snack like dinner. You call it as a dinner, but eat very light. Okay, and limit caffeine. Many of the people have a tendency to have caffeine late in the night, or after after the work, when you just come up and have lots of caffeine. So avoid that, because this is going to trigger your gut lining again. You can have magnesium rich foods. Magnesium rich food, I told you the sources: the super seeds, nuts, healthy nuts, good herbal teas, this kind of things that will provide you good magnesium and helps in your serotonin level up, and hence your energy will be maintained. Your energy level will be maintained. You will not feel like, oh, now I am all, whatever you give me I will eat or drink. So to sustain that energy level, nuts help there. Some of the myths and facts, mostly people, I told you, I had given you one example of my friend, that um, my friend keeps pan 40 every time after meal, after heavy meal. So and thinking that everything will be fine. So don't make antacids as a as a habit. It's overuse can again your disrupt gut balance. Second, people go for gluten-free diet. Gluten-free diet, gluten is present in wheat. It is basically wheat protein, and people think that gluten-free diet will help in maintaining your gut. So no, gluten-free diet is for those who have sensitivity or intolerance with gluten. Okay, if your gut lining is okay, you don't actually need to avoid. Then again, more fiber is always better. This is a myth. Means if I'll take more of the fiber, in my first slide I told you, you have to nutritionally assess your body. your body is able to digest those fiber or not. And for this, you have to reach out to professional. And people think that probiotics work instantly because you have seen a lot of advertisement on social media and think that okay, I'll take probiotic and my gut lining will be okay. No, it will take 2 to 3 weeks time to correct the gut brain axis. So start including prebiotics and probiotics, and gradually you will see the result. In one day you will not get the result. So I have prepared one reset plan how you can go with this. This is a sample one, and every body is different. After assessing it nutritionally, one can go with the desired plan that okay, I can go with. But this is something that you can choose for it. Like morning, if you start with day with your lemon water. Someone has if someone has problem with lemon, it will give you acid reflux. Then you can have just simple a cup or a big cup or glass of lukewarm water. That's it. And then have include high fiber in your breakfast. That is very much required. You include healthy nuts and whole fiber rich cereal like oats. Okay, and go for steel cut oats. Then for giving a boost to your intestine, include one probiotic in mid morning time. You can include buttermilk or curd. In afternoon again, include fermented foods. If you had skipped in mid morning, you can include it here. Then during the day, start sipping on infusion water or water. Do not drink at once a glass of water or a bottle of water, but sip throughout the day. Okay, and infusion water will really help throughout the day. You can sip on. Limit the gut in irritants, which are the most common, which are the most common irritants. Coffee, the caffeine rich any drink or carbonated drink. Then in evening you can go with, in evening, if I say evening, um, you can replace it with your dinner meal. You can go with light soup. You can make at home, you can make vegetable soup at home. Just boil your favorite veggies, pressure cook, and do not throw the water. Cool it and then grind it. Your soup is ready, and that is fiber rich, best nutritious food for you. Try uh, pairing it with a bowl of dalia or a bowl of quinoa or a bowl of oats. Okay, that will be your very healthy, gut friendly dinner meal. And for light snacks in between, or if you want to munch on, start including some magnesium rich food, like some of the nuts like makhana. The fox nut is very healthy. Roasted chana, this kind of things, this kind of food items will not be any kind, will not produce any kind of irritation to your gut lining. So you can start including mindfully these food items. Okay, so my overall presentation was on the role of gut friendly foods. And you can start slowly but start mindfully. How to plan your diet, like how you plan your work schedule. Similarly, you plan your food menu for entire day. Think at night for the next day how you're going to plan. And prepare some good packets or good box where you will put some healthy nuts, healthy seeds. Prepare your infusion water in advance, and prepare your meal in advance. You can batch cook in the refrigerator if you don't get time. So this kind of the healthy habits that is going to help you. And that will eventually help you in correcting your gut brain lining, and the overall result will be the high productivity. Okay, so any questions? I am done with my presentation. If you have any question. See the chat. um, Herbalife drink, good or bad? See, these are good, but before opting for any supplement, Correct your daily day to day, food. Correct your menu first, whatever, what food items you are taking in, and is that food item is irritating your gut or not. Start including prebiotic and probiotic. After that also, if you are not getting result, then go for any kind of supplement. Thank you, Praveer, for I'll give you introduction. Almonds are preferred soaked, or almonds are all the nuts. I'll preferably I always suggest take it in soaked form, because some of the anti-nutritional factors are there. So when you soak, it will go away. So always take soaked nuts. Whenever I eat, this question comes from Asbil. Hello, ma'am. Whenever I eat paneer or cheese, my stomach starts pain and bloating. May I know why it's happening? See, it may be because of intolerance. If you have recently discovered that it is giving you irritation, um, I'll simply suggest you that start having pre or post, start having some cereal, some healthy cereal. Like I had given you examples, steel cut oats, barley, this kind of quinoa, dalia, this kind of item, and then go for this protein item. Sometimes protein is irritant, sometimes protein acts as an irritant. So every body has a different metabolism, the gut lining behave differently. So maybe your gut lining is not, behaving properly with cheese or paneer. So you can include it with some other, you can pair it up with some cereals, some good cereals, and before and after add some herbal drinks. Okay, this will help you. The question from nighttime acidity, acid reflux. Why Pandya? Okay. Question is nighttime acidity, acid reflux, heartburn. What is your special advice? This is a very common complaint. So I would suggest you divide your meal equally in entire day. So if you're eating at 8 o'clock in the morning or 9 o'clock in the morning, give 2.5 hours break, and then it should be your second meal. And then again 2.5 or 3 hours break, and then your third meal. So I won't categorize as a breakfast, lunch, dinner. I would categorize it as a first meal, second meal, and third meal, because the present work life is very, very different. Sometimes you have to go to office at 7 o'clock, who are working in a cycle shift. So consider it as a first, second, third, fourth meal, like that, and equally divide your meal. Time interval should be even. It should not be like, don't give a huge gap, and give good prebiotics. Start including prebiotics to your everyday. Include at every day. You can change your menu, but include it every day. Can we get this presentation? Yes, anyone who wants to have this presentation, you can easily get it. I'll share my number and email ID. You can also ask if you have any further question, or if you want to take some advice or tips. Next question is from Govardhan. What causes rumination syndrome? How to reduce it? See, I had included enough study and some food groups and examples that if you will include it, it will help. This basically is when you reduce your inflammation, your gut inflammation, then whatever food items you are eating, that will be easily digested and you will not complain then. Basically what happens is you are skipping the meals, having anything without planning, without any without unknowingly, you don't know what is the nutrient inside. If you are developing such habits, you need to stop that. To reduce inflammation, you have to give enough uh, prebiotics, and see, probiotics comes later. First, whatever good bacteria is present inside your stomach, start feeding them. Okay, this is the first step to reduce inflammation. and then you start giving probiotic sources. I had included some natural sources of probiotic that you can start with. Start having fermented foods, natural homemade fermented foods. Even then, if you have inflammation, then we need to assess again. I mean, nutrition professional or doctors, they will specially design your food menu, because then only we can understand how your gut, how and why your gut is behaving like that. Okay, then it was very really informative session. Thank you so much, Lakshmi. Which oils are best for gut? See, this is a very important question. Um, I would say a combination of oil. I had mentioned about short chain fatty acids. Okay, um, some uh, some sources of MIFA, monounsaturated fatty acids, are good. Whatever oil you are taking, check at the back what is the MIFA level. If MUFA level is good or high in source, you go with that oil. Okay, sunflower, safflower oil, these are the good items. Even mustard oil is very good. So you can use combination of one mustard oil and other time sunflower, safflower, canola oil. These are the good oils. These have higher sources of monounsaturated fatty acids. Okay. If I'm exercising, can I do intermittent fasting? This is a question from Sudhanshu. Very good question. Yes, you can easily go with intermittent fasting, even if you are on high intensity exercise or low intensity exercise or medium intensity exercise. But we need to plan the diet accordingly. So to design that plan, we need to assess nutritionally. So you need to consult your dietitian first. Next is, do we need to frequently change cooking oils? Yes, Lakshmi, we need to change cooking oils, because every cooking oil means the source has the different kind, has a particular nutrient, and that will give you, like particular oil has good monounsaturated fatty acids, particular has less. So if you will switch, it will only give you the good result. So I'll recommend you switching canola with safflower, safflower with sunflower, sunflower with soya bean, and one regular should be mustard oil. Even if you can use you can use desi A2 cow ghee for just for topping over chapati or over soup or anything. So up to 1 teaspoon of A2 cow ghee you can use. That is completely healthy and safe. Question from Ratan. I face gastric issues despite following healthy diet and daily exercise. See, I can understand, Ratan, but this is as a nutrition professional, I need more details about your day-to-day food choices, your life, your schedule, how, what kind of food you are taking and why that is not giving you result. So you can reach out to your any nearby nutrition professional, or you can reach out to me also. Next question from Kiran. When I had very spicy food in the night, I will get stomach pain in the next morning. This is quite normal. This is natural. And I completely understand, Kiran, this happened. But you know what you have to do? Whenever you had taken spicy meals, next day you should detox your body. The best thing is detox your body. Give more of the prebiotics for 1 to 2 to 3 days, mostly 3 days, and then you will see the result. It will help. And start including infusing water, and reduce the meal gap, the hours intervals, reduce those things. Next is, thank you for insightful presentation. Thank you so much. Next question from Sandeep. How to manage meals while working in night shift? Yeah. If you're working in night shift, again, your day, what time your day starts with, and what time you are ending your, work. Whole duration should be equally divided. And for the people like you, I had said, I won't say now breakfast, lunch, and dinner. I say first meal, second meal, third meal. So 2 meals you should include a little heavy, and two other two should be like fillers or very light. So whenever you are taking heavy meals, Before or after, have lukewarm water or herbal tea, and do not caffeinate. If you are sitting for prolonged hours, uh, stand and walk in between, do some stretching, do some exercises. I sound like while working why I should stretch, but that is actually required. That will help you in maintaining your gut lining. So that is very very important. So these are the small tips that will help you. Next question from Manoj. What will be the diet plan for sugar patients? So for diabetic patients, uh, the diet plan depends on what kind of medicine you are taking. Either you are on medicine, either you are on insulin, how much medicine you are taking in, and accordingly, what is your HbA1c, what is your sugar RBS, and accordingly we plan the diet. But the sources of prebiotic and probiotic you can easily have. These are the sources that that helps in your maintaining your gut lining. And when your gut line is not inflamed, it's good. Your sugar will also be controlled. I had mentioned this in my slide. Next question from Prakash. Groundnut oil is good or bad? See, Prakash, it's a very good question. People do ask me very often. So groundnut oil is good, but you need to switch your oil. Do not use this oil for, your some food items which you can fry with, or if you are using it for a long, long time, you need to switch your oil. Thank you, Shramratan. Thank you. Okay, so I think I'm done with the question session. I am leaving my mail ID and contact number. If anyone wants to ask, or if anyone have query, you can reach out to me.
Thank you everyone for joining this session. If you have any queries or any you require any further assistance, you can connect with Smriti on her email address and she'll be able to help you with your questions. Thank you so much once again, Smriti, and all the attendees. I hope the session was interactive and very much informative.